Good morning. Can everyone hear me? You can't hear in back? Okay. All right. Good morning, everyone. I'm delighted to welcome you all to the 2025 AARP and OLLI at Bradley University Legislative Breakfast. My name is Ryan Grunenfelder, and I am AARP's Senior Director of Advocacy and Outreach, and I've been working for AARP for over 20 years. Today's event symbolizes the ongoing collaboration and shared commitment between AARP and Bradley University's OLLI program in enriching the lives of those aged 50 and above in our community. I want to extend my heartfelt thanks to Bradley University for their unwavering support and investment in education and community development throughout the years, particularly in making our annual legislative breakfast an outstanding success. At AARP Illinois, our mission is to empower individuals to choose how they live as they age. With more than 1.7 million AARP members statewide, we are unwavering in our commitment to advocating for the needs of older adults and ensuring their voices are heard at every level of government. Events like today are a testament to our collective efforts to bring that mission to life by creating space for community members and elected officials to engage in dialogue about the policies and issues that matter most to Illinois seniors. This year holds particular significance as we commemorate the 90th anniversary of Social Security. It's going to celebrate its 90th birthday on August 14th, so just a couple of weeks from now. It's an essential program that has supported generations of Americans. AARP research shows that 89% of Americans consider Social Security vital to the financial security of all Americans. And we agree, Social Security isn't a handout. It's something we've earned throughout a lifetime of hard work. And it resonates deeply right here in the community. There are around 70,000 people that live in Tazewell and Peoria County who are currently reliant on or receive Social Security benefits. And there are 2.3 million Illinoisans in total that are on Social Security currently. That's why AARP has launched a nationwide campaign built around the theme of Social Security called We Earned It, with hundreds of events across all 50 states, the District of Columbia, Puerto Rico, and the US Virgin Islands. We're uplifting powerful stories of individuals who rely on Social Security and sending a clear message that this milestone is not only a time to reflect, it's a call to action to protect and strengthen Social Security for today's retirees and generations to come. And while that work is happening nationally, our fight to ensure financial security, access to health care, and aging with dignity starts right here at the state level, with conversations like today's. By coming together with our elected officials, we're continuing to shape policies that impact the daily lives of older Illinoisans and their families. With that, it is my pleasure to introduce someone who is no stranger to principled leadership and community engagement. Brad McMillan, the Executive Director of the Institute for Principled Leadership and Public Service at Bradley University, who will serve as today's distinguished moderator. Please join me in welcoming Brad.
Thank you, Ryan. Good morning, everybody. Great to see all of you. It is great that Bradley has this long-standing, wonderful relationship with AARP, Ryan and Lori and your great team of volunteers and all the people in the red shirts. I know, let's give a round of applause to all the AARP volunteers. And I am counting on you to protect my Social Security. I'm not going to tell you how many years I hope to still keep working, but it's not that far off in the future. And I am hoping that my Social Security is still there. I'm also absolutely a huge fan of the Osher Lifelong Learning Institute. I think I've taught a class in OLLI every year in my 18 and a half years that I've been at Bradley. I just most recently taught a class in January, a 4-part series. I was bold enough to do a class on dissecting the 2024 election, presidential and congressional. And I'm glad to say no fights broke out. We were able to have civil conversations. So huge fan of OLLI. So I am the executive director of the Institute for Principal Leadership and Public Service and have been in that role for 18 and a half years. And a lot of people ask me, given the current political landscape, whether I still have hope. And the truth is, I do. I know for a fact that Bradley University is developing bipartisan, collaborative, civil, ethical leaders for the future of our country, state, and our community. We have people positioned all over the place that have a different leadership approach than the polarization and division that we see currently. And this generation is really not drawn to extremism. They want to work together to solve problems. So I do have hope. I'm optimistic. I'm also very optimistic about Bradley's future. And that's because of our new leader, President Jim Shadid. Jim is a Bradley alumni, and he's very passionate about this institution. You all know he has very deep roots. His family has very deep roots in the Peoria community. And he has a bold vision. He's got a lot of energy. So we're really, really, really lucky to have President Jim Shadid at the helm of our university. Let's give him a warm welcome.
Thank you. Thank you. Thank you, Brad. Thank you all. And maybe I'll give a shout out to, I don't know if he had anything to do with this, but Don Baker was my English teacher at Peoria High School. So whatever role that played in this, Don, thanks. Good morning, everybody. Welcome to Bradley University. Thank you, Senator Kaler, Representative Weaver, Representative Chung, for taking time out of your busy schedules this morning. We appreciate you, and we can't do, the people here at OLLI and AARP can't do the good work that they do without the assistance and support of strong legislative leaders like you all are, and thank you very much for that. Michelle and Catherine, say hello, stand up. Everybody's introduced themselves, I'm sure. Executive Director and Associate Director, they do great work here. Thank you, Ryan and Lori, for your work for AARP. All right, OLLI has been vital to Bradley and connecting our campus to the community for over 30 years. With over 1,200 active members, it is a nationally recognized program built on collaboration, lifelong learning, and civic engagement. Collaboration, lifelong learning, and civic engagement. This is exactly what our founder, Mrs. Bradley, wanted us to be at Bradley University. People who would serve their communities, people who would be involved in their communities, people who would be involved in lifelong learning and civic engagements. These are values that align deeply with our mission here at Bradley University. We have a great story to tell. I believe we haven't told our story as well as we can or should over the past few years. We need to tell our story. I intend to tell that story. And that story involves all of you. It is your stories. Each of us has a story to tell. Each of us has been a part of the tradition, the story tradition of this university. So it is no secret that since I became Bradley's 13th president, I've made it clear that we are going to create a vibrant roadmap for Bradley University, and our connection to Peoria is central to that vision. So I'm proud to say that I believe this vital role in our community's success, that with all of you, we're committed to working hand in hand with our elected leaders to build this strong future for both Bradley and Peoria. And I simply came here this morning to say thank you for everything you do at OLLI and at AARP and our legislators for being here with us. And I'm going to leave it at that. Thank you very much, everybody. Thank you.
All right, we're going to give our technology person a second here to make a shift. We're actually being live streamed right now. So the camera needs to shift to our wonderful legislators. I just want to say this. I'm going to give each of them an opportunity to give some opening thoughts and comments before we get into the questions. I know you guys are great at asking questions, so make sure and fill out on your table any questions that you have for our wonderful panel. They'll bring them up, and I'll try to get everybody's questions as a part of this morning's forum. But we're real lucky in Central Illinois in that we truly have a group of state legislators that try to work together for the good of the region. And I think it's a little bit unique. It's kind of an oasis of sorts because we don't see that kind of collaboration and working across the political aisle. I could give you countless stories, whether it's the Peoria Riverfront Museum, whether it's projects here at Bradley University, whether it's the community health clinics or whatever, but it is amazing at the federal state level how our legislators have worked well together for the good of all of us. And that's really what public service is about. So with that said, I'm going to go by seniority. So I'm going to let, oh, sorry, Dave, I don't mean to put you on the spot there. But I'll let State Senator open up, and then we'll go to Representative Chung and then Representative Weaver. Again, thank you so much for being here this morning.
Thank you, Brad. I don't think I've missed one of these events, have I? I don't know how long you've been doing this, but I think I've been here every year. And the reason is, and I want to tell my younger colleagues here, the reason is because there's not many times I get to go to speak to a group where most of the people are baby boomers like myself. And so we kind of have this connection. Just to demonstrate that, I just got my first knee replacement done. How many have had knee replacements or shoulder replacements, hip replacements? Yeah, so I'm there. I'm one of you. I was at a coffee the other morning, and there was some retired teachers there, and this just kind of tells you, you kind of grow up in an era where you kind of all relate to the same things. And they were going on about Paul McCartney's concert schedule. They knew every place that he was playing, what size the venue was, how much the tickets were going to be. Do you know those things? No, see, those aren't important to you, but that was important because, and let me ask you this, in February of 1964, there was a earth-changing event that went, do you know what it was? What was it? It was the Beatles on Ed Sullivan. Yes. I was supposed to be in church youth group, and we had to all stop at 6 o'clock when Ed Sullivan came on, and we watched the Beatles for the first time, right? So yes, I am on Social Security as well. So I share that with you. But let me just say something about Jim Shadid. Before I do that, let me introduce the person that really runs my office, and that is Jennifer Ellison, who is the Chief of Staff. And so I know it's always kind of ironic when people call and they say, no, I want to talk to the senator. I want to talk to the senator. I got something I need to tell him. Well, Jennifer's the one that does it anyway. So well, you might as well talk to Jennifer. So if you call and you get Jennifer, you've got the right person. Jim Shadid, I've known Jim for a long time. In fact, I followed his dad, George, into the Senate seat. How many remember George Shadid? Of course you do, Sheriff Shadid. I was on the county board back in the 80s when I first got to know Sheriff Shadid. What a wonderful family. And Jim is such a breath of fresh air for this institution. My wife and all three of my daughters are graduates of Bradley University. I'm not. So Bradley is kind of a special thing in our family as well. But Bradley is such a jewel for this community that I don't know what Peoria would be without it. So I wish Jim the best. Brad, I've known Brad for a long, long time. We met back probably in the days of George Shadid when you worked for Ray. There's a tradition here in Central Illinois, and that is that we do work together across party lines, and we do it for the good of the community because that's what you do. That's the right thing to do. So I appreciate being invited. If you ever get tired of me, just let me know. But otherwise, I'll be back every year. I enjoy this. Thank you.
Good morning. I'm Sharon Chung from the 91st District. Thank you, Senator Kaler, for everything. I have to say, so I'm from Bloomington Normal, but not from Bloomington Normal originally, but I live in Bloomington. And Senator Kaler, his Senate seat goes to Bloomington, and we spent a lot of time getting to know each other the past few years. And I have to say that he taught me everything about legislating. So, and he's been such an incredible mentor to me in my career. So I am so eternally grateful for him. So I joined the legislature in 2023. I was elected in 2022. And I've lived in Bloomington, and I've got 2 young kids, Sophie, who is almost 13. She'll be 13 in 2 weeks, and my younger one, Mia, who is 10. And my background before I came to the legislature was that I'm a professional musician. So, and I did not know that Beatles fact. Well, I mean, I knew that they were on Ed Sullivan, but that was a little before my time. Sorry. But my background is actually in classical music. So if any of you have seen the Peoria Symphony, has anybody gone to see the symphony? Yes. You might have seen me playing there because I'm a violist and
First chair violist.
Whenever they ask me, I don't play there quite regularly as much, but I didn't tell you this, Dave, but they asked me a couple weeks ago to be their acting principal viola for this whole next season. So I said, I can do everything until probably March, April, May. That's where things get a little busy in Springfield, that I can't devote as much time to playing the viola. But so if you go see the symphony this year, you'll probably see me there in the front of the viola section. I know their first concert I'm really excited about. We're playing the music to Titanic with the movie playing. It's going to be a lot of fun. So I'm really excited. So anyway, that's my little plug for something fun in Peoria here. I love the symphony, and Dave was talking about how Bradley's a jewel. I really do think that the symphony is quite a jewel too. It's been so my other background, so I went to Illinois Wesleyan for my undergrad. And so I started playing in the Peoria Symphony in 1997 as a sophomore in college. It was my first orchestral job that I got when I was in college. So maybe if you were going to see the symphony late 90s, you probably saw me there too. I was playing in the back of the violin section, but so my ties to Central Illinois have been here for many years. I spent some time in Chicago for a number of years, getting my master's teaching there, but then I moved back to Bloomington about 16 years ago now. And so, being a representative for Bloomington Normal really has been the privilege and honor of a lifetime. I love Central Illinois so much. And so to be able to, represent our community, to be able to fight for, the values we have here, the needs of our communities here, has been really just an enormous privilege. So I really do enjoy it, and being able to come and talk to people like you, and being in district for me, it sort of is my why I do this all, sort of connecting with you and talking to you and listening and hearing your concerns and getting to know your stories. That sort of thing is really just keeps me going every day. So I'm looking forward to our discussion, and thank you so much.
I'm State Representative Travis Weaver. It's such a pleasure to be here with you all this morning. I'm a hometown guy. The proof is in the pudding. Of course, Mr. Don Baker was my ACT tutor. I owe all my credit of getting into college to him. And I shared the sentiment that Brad had at the start about the optimism for the future when you see these young people. I teach a few classes a year here at Bradley. And one of the things I love about it is I really park politics at the door. It's kind of a chance to get away, be a learner, talk about business, unpack some meaty issues. So my 2 favorite topics, politics and religion, are kind of off the table intentionally. That's not what I'm there to do. I'm there to teach them about business and finance and marketing. But a lot of times on their own volition, the students will go there and they'll talk about some big personal meaty issues. And it's just such a pleasure to just kind of sit back and watch. And I don't even really mediate. They'll just have heartfelt conversations and share their opinion. And they do so in such a respectful way. I think that so many people in our state chambers and certainly in our federal chambers can learn a lot from the students here at Bradley University. So they give me optimism as well, Brad. That being said, I also recognize that sometimes a politician isn't exactly the person that you want invited to a conversation. I'm reminded of a story about a senator and a clergyman who die at the exact same time. Now, if it was Mr. Kaler, I don't know what they would do because he's both. But in this instance, the clergyman and the senator die at the exact same time, and they get to the pearly gates. And so St. Peter's kind of showing them around. This is where the pool is. This is where everybody eats. And he says, okay, Mr. Preacher, we're going to take you to your house first and we'll show you around. And they get there and it's just like a shack. I mean, 1,000 square feet, a front door, one bathroom, no amenities. And the politician's kind of sweating, thinking, wow, this is what the preacher gets. What am I going to get? So then that's done. And they take him to the next place and they say, okay, Mr. Senator, this is where you're going to stay. And it is like the biggest mansion you've ever seen. 3 swimming pools, indoor, outdoor, 10 bedrooms, a football field in the back, tennis courts. It is just decked out. And the senator is kind of sweating, thinking that there's been a mistake. And so, he says, St. Peter, what's going on? Why do I have this mansion and the preacher just has the shack? And he said, you got to understand, Mr. Senator, we get preachers here every day. We've never had a senator here. So that being said, I speak on behalf of Representative Chung and Senator Kaler. We're so excited to be here. We're so honored that we've been invited to be here, and we just look forward to a really robust discussion this morning.
So before we get on to the big questions, I have to say that there's other big news when it comes to Representative Travis Weaver. He gets married in 2.5 weeks. So let's congratulate him on his upcoming nuptials.
Thank you.
So this question, I'm sure all of you could have expected, but the first question, and again, I'm starting to get some, but please continue to fill them out and bring them up, is how do you anticipate the big, beautiful bill will affect the vital programs that matter to Illinois, like Medicaid, SNAP, and efforts to improve nursing home quality of care? So again, we'll go Senator Kaler, Representative Chung, Representative Weaver, and then the next question will go to Chung and Weaver back. So we'll flip it around a little bit, but Senator Kaler, we'll give you that question first.
This is a big concern. And of course, last year when we were doing the budget, there was so many unknowns. We just had to kind of wait and anticipate what might happen. But there's some timing sequences in the bill. It's called the big, beautiful bill. I call it the big something else bill. So a lot of things kick in after the next election. So we have to kind of anticipate when some of those strains might be put on the budget. So we're getting briefed now with the staff and people that are looking at this as we go into next year's budget discussion. So we know the next year's budget is going to be a tough budget year, going to be tougher than this year, and this was a tough year. And so we'll just have to anticipate what that's going to be and how we're going to deal with it. We do not have the ability to backfill all the shortfall that there's going to be. So understand that there may have to be some cuts.
Yeah, Senator sort of hit upon a lot of things I was going to say, but yeah, I think that we going into this year, because our legislative session basically goes from January through May. So when we passed our budget, the big, beautiful bill had not been passed yet. So we couldn't anticipate, but I have to say that was something in the back of our minds all year long, because we had heard about things that were possibly coming. But again, it made it sort of difficult to be able to figure out how we were going to pass our budget for the state, which, has to, all the things that we usually do pay for in the budget, with also thinking about these things possibly that were coming on the horizon in mind. So I do know that we have some of the things I think that I've been talking to a lot of people about that I'm really proud of that we were able to do in the Illinois state budget this year was to put more investments into different parts of healthcare. So we've got more money for FQHCs, more money for free and charitable clinics, greater funding for DSPs And there's another sort of worker, I can't remember what they're called, but it's the people that sort of, the direct service professionals, the medical professionals that work with our most vulnerable populations. We've given them also a little more in wages. So I think that those sorts of investments, I think, will help when some of those strains probably do end up happening. But, I think that it's something that, like the senator said, that we are continually sort of talking about, trying to figure out what it's going to look like. I have a feeling that maybe when we go back in October for veto session, we might start to have, those conversations are happening, but, they'll probably be presented to the caucus as a whole. But yeah, I think that it's like he was saying, that it's some of these things, the way they're timed, we're not going to feel a lot of these effects quite yet right now. But I think it's trying to figure out how the state can be best prepared to sort of anticipate those changes.
It's such a great question, because it really is the question, right? What's this legislation going to have as an impact on all of us, specifically as legislators, yourself as recipients? And it's a hard one, because the answer is that my truthful answer is I don't know. And I really pride myself on being somebody who can put partisan politics aside and really call balls and strikes in a fair way. President Reagan used to say, don't be afraid to see what you see, which is to say, if you know the reality, you can be a much more effective legislator than if you just know your reality, right? So don't be afraid to see what you see. So I've really tried to dig to the bottom of, is Mike Johnson telling the truth, or is MSNBC telling the truth? Is President Trump telling the truth, or is Hakeem Jeffries telling the truth? And the reality is, until it's implemented, it's going to be hard to know. But when somebody who I know personally and respect, like Darren LaHood, says that the point of this is to eliminate waste, fraud, and abuse, I take him at his word. And my hope is that the result will be something that's actually very good for the people in this room, because the point is to get rid of the people that don't need it, that are abusing the system, and preserve it for people who do need it, people with disabilities, seniors, pregnant women. So it hasn't been implemented yet. The reality is, I've really tried to get to the bottom of this. I still have a lot of unknowns personally. I don't expect anybody in this room to have all the answers either. But my hope is that it ends up being a positive thing for the people who need it, because that is supposed to be the point, that we preserve it for the people who need it by eliminating waste, fraud, and abuse.
Thank you. So the second question I'm going to ask, which is not surprising with this group, is what actions will you take to lower prescription drug costs for Illinois seniors and family caregivers? And so Representative Chung, I'll have you start with that one, and then we'll go to Senator Representative Weaver and Senator Taylor.
So I believe, was it last year that I participated on a town hall about sorry, what is that called? The bill that you sponsored?
The prescription drug affordability.
Yes, thank you. The prescription drug affordability. Yeah, it's right there. Right. Okay. Anyway, I participated in a town hall. I think it was with you. Ryan was there too. And it was at Alpha Park Library, was it? Okay. Right. So now I'm putting that all together in my head. And then Dr. Krishnamurthy was here too, right? So it was a very interesting town hall where we were really kind of getting into the sort of nuts and bolts of the Prescription Drug Affordability Act, trying to set up these boards that are sort of trying to figure out, to look at different drugs that are being used, trying to set costs for them. Now that bill, I understand, has not been passed yet, but it's one of those things that I think that those discussions are happening, because we know that this is an issue for many of you here in this room. It will probably end up being an issue in the room for me at some point, and for you too, Travis. But it's one of those things that I know that a lot of people are, it's a concern, and it's something that's at the front of your minds, trying to figure out, what we don't want to see, at least with the senator sponsoring this bill and myself, supporting it. We don't want to see people having to make those tough decisions between paying some bills and then paying for your medicine that, will keep you alive. So, those sorts of discussions I know that we're having, and that's something that I know that we're still committed to trying to do. I don't know. I guess when we come around to you, you can talk maybe a little bit more about the status of your bill. But that's something that I know that he and I have been, the senator and I have been very committed to trying to see what we can do to solve that problem.
Yeah, I would echo that. This spring we passed 340B coverage legislation. Oh, I looked it up last night, almost unanimously. There was one no vote, I think maybe because of a conflict of interest. But it, again, a bipartisan issue. We know that 340B exists to pass savings and benefits on to the recipients. There were some issues there of how that was being handled. But the bill that we passed requires 100% of the benefit, the discount to be passed on to the recipient. So we'll continue to push on things like that.
That was actually the PBM bill.
Yeah.
The 340B,
You're right.
340 bill is not called. I was chief sponsor of the governor's PBM bill, which greatly restricted PBMs from taking money out of the middle of the prescription drug programs. We also had the 340B bill, which is a bill that's very important to FQHCs and to hospitals. I'll explain that one. But the PBM bill was important because what is happening is that, are you familiar with pharmacy benefit managers? I'm sure you are. I mean, as seniors, we're very aware of what happens with our prescription drug plans. But PBMs initially were set up to be able to help control costs. And what happened was over time, they became kind of the middleman, the ultimate middleman, because they made deals with pharmaceutical manufacturers, and they were able to get rebates. Do you know that rebates are really what drives the money in pharmacy? So they will get rebates because they then put these on a formulary. And so I don't know how many of you have formularies where you have to buy from certain list of drugs. Well, that's because the PBMs have made a deal with that manufacturer and they get rebates for putting those drugs on a formulary. And those rebates go into their pocket. It becomes a very profitable line for them. So the governor, and he asked myself and Representative Natalie Manley to be the chief sponsors of this. We passed this bill which says 100% of the rebates now have to go back to the plan sponsors or to the individual. There can be no more steerage. And this bill has not really gone into effect yet because I just got I had to sign up with a new health plan this year because Health Alliance went out of business. And so I got a notice from my PBM and said that we want you to go to this pharmacy. Well, that's now prohibited. They can't steer you to a pharmacy because what's happening is we're creating pharmacy deserts. My pharmacist is Allwins over on Western. And it's because I trust him. I know Mike Meisinger, and that's where I choose to do business. But if they get squeezed out, and Peoria is not as much of a problem because we have other pharmacies here. But look at all the small rural areas where sometimes if you don't have a local pharmacy in that town, you'll have to drive 40, 50 miles to get your prescription filled. There's pharmacy deserts that are created in rural areas and in urban areas. So if you can see that in urban areas, stores just leave, much like the food deserts that we have. So this bill is trying to turn that around, and it's going to help prevent pharmacy deserts from occurring, and it's going to help put more money back from the rebates back to where they belong, to the plan sponsors and to the individuals. That bill passed. It passed with, I think, one dissenting vote in both chambers. It was a good bipartisan bill because everybody has pharmacy issues in their area. We also had the 340B bill, which is 340B was a program set up back in the 90s, which this federal government said that they're going to allow certain hospital and health provider organizations to buy drugs at a discounted rate and then to be able to take the markup on those drugs and to use them for other kinds of charity care. And a lot of our hospitals, OSF and Carl included, they have a lot of programs where they will divert that money into basically what would otherwise be charity care. Now, FQHCs, the Heartland Clinic is an FQHC. When the FQHC, I was on the board when that went from the free clinic to the FQHC. And what the federal government said at that point, and Joan Krupa was the first director of that, if you remember, the federal government said you have to take your money from the 340B program all the money you get from Medicaid and from Medicare, and you have to be able to spread that over your whole business so that anybody who comes in the door, you have to be able to treat them. And here's the funding sources you can use to do that. And so if the 340B program is essential to places like the Heartland Clinic, they would not exist if that goes away. The pharmacy manufacturers tried to do a fast one on all the 340B entities. They said you can have only one pharmacy where you get that special pricing, and all the other pharmacies, are off limits. Well, the state of Arkansas, West Virginia, states like that sued the manufacturers for doing that. They won, and so we're kind of going off their coattails and trying to do the same thing and saying you can't do that. You can't limit. I mean, think about what that means. Any area where you have a health center, you have a vast area of clients that they serve, and if you're wanting to restrict it to one location, then that really negates the program. And that was their point. So we're working really hard to make sure that healthcare is not going to be put out of sight for people to be able to afford. You should not have to decide whether you're going to take your medicine or pay your rent. And that's the issues we're facing. And we're still pursuing that, but we've made some progress. We've got more to do.
So this is a kind of a segue question related to some of the discussion, but I think it's an important one. This comes from our audience questions. Does the state of Illinois have a plan to support rural medical facilities? And we'll let Representative Weaver start with that one.
Again, I think it's going to be a little bit of wait and see. I actually was just recently looking up, the White House has a whole website dedicated to myth and fact, right? Associated with the Big Beautiful Bill. And one of the points on there is their commitment to rural communities. Now, again, I started out my last question by saying, I don't know the answer to these things. I'm not a federal congressman. All that I can do is my own research. And my own research tells me that they're committed to rural hospitals not being impacted. Time will tell. I hope that that's the case, but it's a little tricky to come up with a strategy on something that you don't know what the outcome is. That being said, I represent rural Illinois. And if you think that I'm going to abandon rural Illinois, you've got another thing coming. I can't exactly say what I'm prepared to do for rural Illinois hospitals or what exactly that looks like. Again, because I don't have a crystal ball and I don't exactly know what the future holds. But we have to have rural healthcare. Just over in Elmwood, we're working on the YMCA putting up a health center associated with Graham Medical. And that's massively important, not only for immediate care of, emergency heart attack type situations, but also for preventative care, being able to swim in a pool, being able to go there for your PT, massive benefits to having things like that. And I've supported that. I've worked with the YMCA and Graham Medical folks to help bring that along. So I'm committed to rural healthcare. I'm committed to rural Illinoisans. That's the district. Those are the people that I represent. But as far as what I'm prepared to do as an Illinois legislator as a result of something that happened federally, it's just a bit hard to answer without knowing how things will be implemented.
Well, it's going to be a couple things happen when you start to reduce the rules of Medicaid that affects hospitals across the board. Especially in poor urban areas and in rural areas. And here's what's going to happen. You're either going to have hospitals that are going to close their doors because they can't make it, or you're going to have, the notion that because you reduce the roles of Medicaid that you're going to save on healthcare is just erroneous. Poor people get sick, whether they have Medicaid or not. And when they get sick, they sometimes, if they don't have the proper primary care, they'll wait till their issues become so profound that they have to go to the emergency room. And once they're in the emergency room, if they don't have Medicaid coverage at that point, the hospital is obligated to treat them. Who do you think pays for it? Everybody else that has health care. So we still are paying for it. We're just doing it in a convoluted way. this is going to have devastating effects upon our whole healthcare system. And I work a lot with the Illinois Hospital Association because they represent safety net hospitals, which are urban hospitals. They represent mainstream hospitals, which are like Carl and OSF. They represent critical access hospitals, which are rural hospitals. And we're gonna see some hospitals close because of this.
But let's just think about who we would specifically be taking care of as Illinoisans. If the people who are not being impacted are disabled, seniors, pregnant women, able-bodied people who are working, able-bodied people who are looking for work, able-bodied people who are volunteering up to 20 hours a week, they're covered. That means the only remaining people are able-bodied people who are not working, not looking for work, not volunteering up to 20 hours a week. So it's really hard because we got to keep these rural hospitals protected. But if the result is that now Illinois is explicitly subsidizing this group of the population who are able-bodied, yet not working, not looking for work or volunteering, I can tell you, I'm more than happy to help people who are willing to help themselves. But if we're stuck in a position where we're helping people who are not willing to help themselves, I'm not prepared to put that burden on the Illinois taxpayer.
What I said stands.
Representative Chung.
And I think, what I last saw, because I spoke at an event yesterday, but I think the estimates that we've sort of already seen is that possibly not up to 9 rural hospitals will close in Illinois. If some of these things are sort of worst case scenarios do happen. And that's rural hospitals, again, they're so few and far between already to begin with. And then when you're taking away that care from people who need it the most, that will have devastating effects, as the senator said. And I think, it's sort of up to us, I guess, and I keep saying this, we want to be able to be prepared as much as possible. Again, there's no way that we can backfill this all, but we want to try and minimize some of these effects. So I think it's just being prepared, trying to have as much information as possible, trying to figure out how this is all going to possibly look, maybe all these sorts of different scenarios. But I think that even Representative Weaver said this, I think their commitment sort of stands to be able to protect rural hospitals. I think that that's something that I think all of us here could probably agree on. I guess how we get there or what those scenarios might look like maybe are a little bit different, but I think that for all of us here, we are trying to see what this will all look like, I guess, and that's a lot of I guess that's another thing we've been saying here today is that we don't really know what this is all going to look like. And I think the best that we can do is just to have as much information as possible.
What the federal government does is they have a pot of money which they allocate to each state for Medicaid, and that's going to be reduced. And so then we're going to have to take that and because it's a 50-50 match program, it means that the state portion is reduced as well. So this notion that anybody able-bodied is going to be able to should not have health care, that doesn't make any sense. That's a nice talking point on a website, but that's not reality. The reality is that the federal government gives the states a pot of money, and then we have to match that 50%. And if that is a much lower number, then something's got to be cut.
So there's a couple questions here. What I do is I combine some questions that are kind of on the same topic a little bit. So I'm going to kind of weave these things together a little bit, but it all deals with water quality issues. And part of it also is the issue of private water companies continuing to buy up local water systems. And then one of the other questions is, what would you be willing to sponsor an informational forum on the condition of our water quality? So when it comes to the issue of kind of combining those issues, what are your thoughts? And I think it's Representative Chung, I'm not sure. Yeah.
So I have to say that the private water company issue, we don't have in Bloomington. In Bloomington and Normal, we still have the municipalities control the water. So I have to say, I did not know this issue existed until I went into the legislature. And I know that here in Peoria that we have was American Water. And so, but I do know that water quality is an issue. even though, again, Bloomington and Normal have municipality controlled water, in Bloomington, we had a big issue this year with our water quality. If any of you went to Bloomington to go eat at some point earlier this year, you might have noticed that your water at your table tasted really bad. And it's because in Bloomington, we have these lakes that we draw our water from. And they sort of go from one lake to the other, I think, and somehow my understanding, there's some algae blooms that affect the taste of your water, but it was really bad there. And I guess because of some of a lot of science things, I never pretend to be a scientist, but something to do with I think there was a bit of a drought earlier, and then like it affected the level of the water and something like this. So anyway, I heard it from a lot of people who were very concerned about the quality of water and the taste of your water in Bloomington. And, you know, again, city was saying that it was safe. They kept testing it, but they did install like different filters. And that again, we paid a lot of money for that. The city did, but just to improve the taste of the water. And I have to say it does taste okay now, but there was a couple months there where it was pretty terrible. And I think we've also been dealing with this issue in Bloomington, and I think Dave knows about this. I talked to him about it a while, but it's not in our district, but it's just outside of our district, but still in Bloomington. But it's a little pocket of Bloomington that's not incorporated into the city. And it's a little subdivision of maybe about 70 homes, 50 to 70 homes, where they had their own private water company that somebody developed in the 50s when this subdivision went up, each house had their own septic. Now the well is failing. And basically, if any of you like go on to WGLT, they did this big story about it recently. You can see that people had bottles of water, like just like your plain plastic water bottles, and they filled them up from water that's coming from their tap. And it is all shades of yellow and brown. And it's one of those things that I think, again, this neighborhood is the boundaries, like the city is surrounding it. It is just this one weird little pocket. And they're trying to figure out what to do. But I think what became very clear to me when I was talking with the residents there and my friend who's the county board member that represents that area, I think that in the year 2025, people need to have clean drinking water. I mean, I think they were saying that people were even afraid to even wash their clothes in it. And that's saying something. So, I think we all deserve clean drinking water and just to be able to want to bathe and wash your clothes in it and not fear the quality of it. That's something I think that hopefully we can all agree on here. But again, I have to say, I'm not fully into the American Water Company issue. I do have a tour set up for there in a couple of weeks. So I think I'm going to learn a little bit more and find out more about that. But that's something that I understand has been an issue here for the residents of Peoria for quite a while. And I guess, I can maybe rely on my colleagues here to speak more about that, but I do think that people deserve clean drinking water. I mean, it's to me, it's a right.
Representative Chung, would you do us a favor? And what's your northern boundary?
Northern boundary is pretty much like North Normal. And then it kind of goes up towards Carlock, which is just outside of Bloomington, kind of travels along I-74, maybe collects in the communities of Deer Creek, Congerville, Goodfield, and then some of Morton, but not very much. A good chunk of Washington, Bartonville, East Peoria. So
she has a lot of area close to where we're at right now.
But not Peoria itself.
I wasn't sure that you guys were aware of that. So she really is a tri-county Central Illinois state legislator. And we're thrilled. This is the first time that she's been at this. So we're thrilled to have her. But I want you to know that she does geographically come pretty close to where we're sitting today. So it's great to have you here. And that gets me to my next question, which why it fits that you're here is one of the questions is, what is the most critical economic issue facing the Tri-County area, in your opinion?
Oh, you're going to start with me again?
No, that's Representative Weaver gets to start with that one.
Well, I can tell you the two top complaints that I get in my district office are property taxes and the price of power bills, the Ameren bill. I would say those are the two top things. Property taxes are tough. I always say every single dollar spent is a dollar tax. There's no way around it. And so if you're going to cut property taxes, that means that you have to cut spending, which is really hard at a local level because the local level property taxes are spent on police and fire and roads and teachers. So that's hard to get at. I do think that we could have some support from the state. I got a couple of ideas and bills filed about how we could do that. But specifically with the economic growth, we've got to get cheap power back in Illinois. It used to be one of our key strengths, and that's really deteriorating. Under the governor's administration, Illinois has fallen from the 27th most affordable power to the 36th most affordable power in the nation, about a place or two every year that we've fallen. And as you think about Illinois' situation, right, we've got so many great resources here, more miles of rail track than any other state, fantastic waterways that can get you to ports both through the south, through the Illinois and Mississippi, and up through the north, through the Great Lakes, world-class secondary institutions, Bradley, Northwestern, the U of I, U Chicago. We really have so many great strengths. And we used to have, as a part of that portfolio of strengths, really affordable power. And that's so compelling for manufacturers to say, I'm going to go to Illinois because one of their biggest line items in their annual budget is how much they're spending on power. And the more that we continue to fall back in those rankings, right, when you're 27th, it's like, hey, they're middle of the road. They're right in the heat. They're competitive. As you fall back to 36 and we continue to trickle back down that ranking, it's going to be tough to continue to recruit businesses here because so much of their expenses are power. And that's for economic development. But gosh, I feel so bad for low and middle income families that used to have $300 left at the end of the month to go out to dinner or buy their kids something or back to school clothes. And I don't know about y'all, but my power bill last month was devastating. It was 20% more expensive than my previous most expensive power bill that I've ever had. And I just live in a small apartment. So I was a little sticker shocked when I got it. But if I had a house, even a small house, I can't imagine how much more expensive that was, not to mention try to put food on the table for kids. So it's an economic need for us, but it's also just a societal need that we've got to get back to having clean, affordable, reliable power.
Yep, the energy issues are really coming front and center. For a long time, electricity was the demand was pretty much flat because we were able to offset, the demand because of efficiencies. So every household now has LED lights instead of the old kind of a bulb. So we gained a lot through efficiency. That's not true anymore. Now, what's happening is that our whole power system is being threatened by these big data centers, and data centers are wanting to come in and to make deals with nuclear power plants for exclusive rights to their energy. We in Illinois have more nuclear power than any other state in the union. We have 11 generators, and it used to be back when we were in college. Remember how a bad name nuclear was? It has changed a lot in terms of the technology. There still, are some storage concerns in that, but nuclear energy is a carbon-free energy at this point. And I was one who supported lifting the moratorium on nuclear energy. I think we need to see expansion of it, especially with relation to what they call the SMRs, the small modular reactors. I don't think you're going to see the big nuclear power plants built anymore. I think you're going to see the small ones built. They build these each it looks like a torpedo, but each canister will generate about 77 megawatts. They can be built in a factory. What you do is you set them up in sequence, so you have like 6 or 8 or 12 of these, and they can be ramped up and they can be ramped down, which is different than a nuclear power plant. You don't modulate what power it's produced. You just turn it on and it produces power. And that's why we had to, a few years ago, actually bail out the nuclear industry because they couldn't compete with wind and solar. And they still can't. when there's a windy day or a sunny day, wind and solar is the cheapest form of electricity you can get. We have a lot of wind and solar in Illinois. Our problem is that the two grid operators, PJM in the north and MISO in the south, have not kept up with transmission. We have projects that are waiting to get hooked up into the grid, and they've had to wait, 2 and 3 years. We have to be able to get electricity to where it's needed. And that's a big problem. There's been some discussion about whether we should get out of both of those systems, because PJM goes from Chicago all the way to New Jersey. And they do, every year they do what they call a capacity auction. And that's one of the reasons that in our area this summer, we're seeing that prices are high, because MISO also did a capacity auction, and the auction was very high. What a capacity auction means is that you don't actually pay them for the electricity that you use. What you pay the companies for is the electricity that they can produce. Powerton, just south of Pekin, it's a 1,600 megawatt plant. It's a huge plant. They don't produce a whole lot of electricity. They make their money because they sell to PJM, which is in the northern part of the state. They make their money through the capacity auction. They make their money because they were able to bid into the system that says, if you need power on a hot summer day, we will be able to provide you this much power. They get paid to do that, and whether you use it or not. And so the economics of how power is bought and sold is mind-boggling. I don't pretend to understand it, but we've got to look forward to really creating the kind of policies around having a vibrant electrical system in this state. I think we are in many senses leading the nation in terms of what we've seen with solar and with wind, and we need to continue to pursue that. The question you first asked was about a water company. Would you want to respond to that? I was on the city council for 8 years, and we dealt with the Illinois American water issue every 5 years. It comes up to a vote as to whether you want to pursue a buyout or not. I've never was one that said we should pursue a buyout, because the numbers I remember back in the 90s were that for the city to be able to afford to purchase what the value was, and the value is somewhere between what's in the ground and what's hard assets and what the potential of their business is. And so arbitrators are going to decide what that value is. But the cost of us having to finance that as Peoria residents would be pretty tremendous. Had we had a municipal water system to begin with, fine. I think municipal water systems are fine. East Peoria has one. Like I said, Bloomington Normal has one. Illinois American, I think there's just two issues here. One is water quality. And I do think that Illinois American has good quality water. Right now, they've changed some of the standards, and so there's some concerns about lead in the water. And you can ask Illinois American to send you a kit where you can get your water tested. We are going to engage right now in a massive program across this country of replacing lead lines. I know that when we had a water leak out in front of our house, and they discovered that it was the old lead line from the main source to our meter, which was in the sidewalk, that was all lead. And so that's been replaced by plastic. Now we have plastic that goes to our house. But in older neighborhoods, you can bet that if it hasn't been dealt with in a while, you've probably got a lead line there. The other issue, aside from water quality, is cost. And that has to be regulated by the ICC, and there has to be reasonable return on investments there. I'm not one that's advocated that we dump Illinois American. I am concerned, however, that the price keeps going up.
Brad, can you remind me what question you want me to answer? I'm sorry. We've talked about a lot of things just right now.
I've got a lot track too, Representative Chung. We'll just go on to the next. We'll go to a new one.
Thank you.
So I'm kind of interested to see how you guys answer this one, because I know you don't want to be put on the spot or biased, but I just am curious. What is the best news source for the Peoria area in regards to state and local issues?
WCBU, without a doubt.
Yeah, and for us in Bloomington, it's WGLT, which is also the NPR station. There's and I think you all have talked to Caesar, right? He's the State House reporter for WGLT. I think he's been, have you talked to him at all? No? Okay.
Yeah.
And so, you know, what's kind of great is that there's actually a person who is in Springfield covering things daily. And so he comes and talks to me a lot of the time. Will text me being like, hey, do you have a reaction to this or whatever? Or he has an idea for a story. So he and we have a little like a little alcove that we go hang out and talk in, that we try and find that's quiet, close to the chamber. But yeah, I think that just, again, with having reporters like that who are part of the action every day, I think that that's very valuable. So I would say like WGLT, WCBU.
Yeah, I totally agree. Actually, as soon as I started campaigning, it was one of the first realizations that I had. And I think it's because, you know, you get these college students that really are engaged and want to make a career for themselves. And also maybe they're naive enough to not know that the questions that they ask might be offensive or putting you on the spot, or that they might cause controversy. That they come into it, I think, so green and curious that the questions they ask are the right questions, because they're not trained to think about the repercussions, or, oh, if you ask that, so and so might not give you another interview, or, you know, if you ask that, you're really going to put that person on the spot and they might not like you. I mean, they'll just come and ask tough questions, good questions, because they want to be good reporters. They're taking these classes in school about how to be tough reporters and ask tough questions and to push back. And also, I think there's a component that they're still new to the field, and so maybe they don't know the answers to certain things or certain historical on policy, and so they'll ask you for it instead of just assuming that they know the answer. They'll ask you because they're also learning. So definitely WCBU, WGLT. I just have tremendous respect for these young kids that are coming up. One thing I will note that's a little bit separate to that, though, is I've really seen people's, I guess I call it their BS meter, change a lot over the last 15 years. And I think that 50 years ago, everybody had a great BS meter, because if it was you and me talking and I thought that you were pulling a fast one over me, I had to find out right then and there on the spot if I was trusting you or not. And then about 20 or 30 years ago, maybe 20 years ago, things changed. And if you were trying to sell me a oil filter, and you were charging me a lot for it, I could say, yeah, 1 second, let me just check and just see if that's right. Right. This became our BS meter. And so now I think that we're shifting back in a point in time where this is where the BS is coming from. And so now we're relearning how to have that BS meter ourselves. So when you get a call from somebody that says, hi, I work for Visa, what's your social security number? We're trained, you probably don't work for Visa, and I'm not going to give you my social security number. So that's a little bit beside the point. But I think in journalism in general, I personally feel like I'm seeing people seek out multiple sources, ask tough questions, think that something doesn't quite check out, even if a once trusted source says that it does. So I do have optimism about the future of people being able to sniff out BS.
Oh, and I also wanted to add one more person, is that, so in Bloomington Normal, our newspaper is the Panagraph, and they are, Lee Enterprises is the parent company for the Panagraph. So Lee Enterprises has a State House reporter too, who's very well respected. His name is Brendan Moore. So I've spoken to him a lot. But, you know, I think that especially like when it comes to Illinois State House news, I think it's really important to sort of have those people that are on the ground every day, have you know, cultivated those relationships with different lawmakers to be able to get the news out there.
So, John, I hope I don't do a hatchet job on your question here, so you can correct me if I mess it up. Will the state provide funds to local school districts for the mandated new school board members training, as well as funds for special education dealing with physical restraint and isolation? Did I get it right? Okay.
Who are we at on that?
Perhaps. Yeah, yes, they should, whether we will or not. It depends on the budget. It's going to be an ugly budget year, so I'm guessing it's going to be pretty much up to the schools. It's going to be an unfunded mandate.
Yeah.
And that's too bad. And there's been a long history on unfunded mandates. The reality is that the state is not going to be in a position to do anything extra. Then, in fact, we're going to have to probably see some cutbacks next year.
Anybody else want to? No.
No, he kind of
No takers.
Can I didn't get a chance to expound on the last question.
You can expound away. Go ahead.
Well, I just wanted to say that, of course, WCBU is what I get my news from. And I read, 4 or 5 newspapers every morning, from the New York Times to the Wall Street Journal to the Pantograph to the Journal Star to Politico to Rich Miller. Rich Miller is a must. So, but I'm concerned about the whole area of free press and First Amendment, because right now it seems to be under siege from lawsuits, and we're starting to see a shift in how free the press is, because if the press begins to concern itself about lawsuits and protecting itself, just like universities, I think we're in a very dangerous time, and I think we have to be careful of that.
On the school question, philosophically, I always say before we pass the bill, we got to ask 2 questions. Question number 1, is this a good idea? Question number 2, can we pay for it? We have no shortage of good ideas. We have all sorts of things that we can be doing. And when it comes to water quality, that we absolutely should be doing. But then you have to ask this second question of, do we have the money in our current revenues to pay for it? Or is it something that we would require taxes in order to pay for? And when it comes to these unfunded mandates, it's such a challenge, because we can say, yes, it's a good idea, and we can't pay for it, but somebody else should. And so I think that there's actually like a question 2A and 2B that we need to be asking of, can we pay for it? And if we don't want to be paying for it, is it fair, right, and just for us to be asking somebody else to pay for it? So that doesn't specifically answer your question. My guess is the way that we push on unfunded mandates, we most likely won't be funding that. But we've really got to get back to a situation where, before we add new regulation onto our school districts, we've got to ask the question, is this a good idea? Of course, more training for school board members, more opportunities for special ed students. Those are wonderful ideas, right? But on the training for school board members specifically, do they have the time? Do we have the money to pay for it? How is this exactly going to work? I think sometimes we're not incredibly thoughtful about what the downstream effects are of some of these good ideas.
I think there's actually a better question to ask, and you're correct, Travis, in that. But President Harmon always starts our leadership meetings where we go over all the bills that are being filed, and he says, "What problem are we trying to solve?" See, it's not a matter of just having a good idea, because everybody has a good idea, right? It's, what problem are you trying to solve? And if you can't articulate that, then maybe it shouldn't be legislation. Maybe it just ought to be a good idea. And I think that we need to be more discerning in terms of what we're trying to solve.
Oh, do you mind? Okay.
No, go ahead.
But I do have to say also, so, we have in the House, we have our House Democratic Caucus, which has 78 members. And we have several sub caucuses. So that's, it could be the Black House Caucus, Latino Caucus, Women's Caucus. I'm also part of what they call the New Democrat Caucus, which was formerly known as the Moderate Caucus. So we are made up of more, either you could be representing a moderate district, like myself, or you could also be, like, say, a representative in Chicago, but you might have more moderate leaning views. So we kind of run the gamut from, and there's 26 of us, I believe, in our sub caucus. And so we run the gamut from Chicago representatives, suburban representatives, and downstate representatives like myself. And I feel like this year, especially when it came to unfunded mandates, bills that were sort of being introduced, that's something that we were all sort of looking at as our sub caucus, because we wanted to, one of the things that I think that we are really committed to in our sub caucus is to really make sure that we're protecting the financial health of our state. And so that's something that we talked about a lot. And so I think that there were, I don't know, every year, thousands and thousands of bills are introduced. And I think that our caucus did ask a lot of questions when it came to some bills, and some of those bills, which were more unfunded mandates, probably ended up not getting called because of the questions that we raised. So I have to say it's not always a Democrat versus Republican issue, I guess, in that you have a room full of 26 Democrats who are also raising these questions. Again, they're good ideas, but how are we going to pay for it? So, and especially with knowing the tough budget year we had this past year and the tough budget year we're going to have next year, I think that those were important questions for us to ask.
So this comes from our online people that are watching this streaming, and it's a new topic area. I'm going to kind of change it a little bit because he's attributing something to another elected official, which I'm not going to do that because I don't like to take words from other elected officials. But the bottom line is, how do you think the tariff issue is going to impact Illinois? And this person particularly is interested in how it might affect farmers and agriculture.
Do you know who's starting, Brad?
You want to take it, Senator Kaler, and just go down the way? Okay.
I think that it's going to hit farmers maybe harder. It depends on what it does to their markets, for selling corn and soybeans. I'm not against tariffs. I think that tariffs applied in the right way can be effective. I think that Liberty Steel, which is a former Keystone Steel, is going to benefit by having some protection from cheap foreign steel. So tariffs are what the president has done with tariffs is kind of I don't understand it because it's all over the place, and it seems to be more punitive than good economics or whatever. So I don't understand what that philosophy is. But if you go back to what tariffs try to do, and that is to try to protect your vital interests of your industries, and so I think there's going to be some winners, and I think there's going to be some losers.
So let's see. Last month. Well, actually, no, it was earlier this month. Congressman Raja Krishnamurthy, who's originally from Peoria, he came to Bloomington, did a little visit. And so I took him around to a couple of businesses. And one of the businesses, small businesses that we have in downtown Bloomington is a game store, a board game store called Red Raccoon Games. It's really cool if you ever want to go see it. And one of the things that the owner talked to him about was how the tariffs were really affecting him, and how again, I think just that week that the congressman visited, I think that the president announced some new tariffs on products, I believe, from Japan and South Korea. So when you think of a game store, they have lots of anime and these manga and these sorts of things that come from Japan and merchandise. And all of a sudden, he is trying to budget and figure out how he's going to pay for those tariffs, because he said that earlier that year, at some point, he was hit with a bill. I can't remember how much it was for, but it kind of blew my mind, again, of money that he was not expecting to have to pay for. Because, again, he's a small business owner. He is trying to count every nickel, trying to figure out how to invest it back into a store. And so he was saying that he was hit with this bill. The tariff bill came directly to him. And how he had to try and figure out. So again, he was trying to figure out what this whole new tariff situation was going to look like for him. So, I mean, it's not only affecting farmers, but it's affecting small businesses in our communities for, good small businesses, like people who just want to provide a really great business for our communities, like a game store. So, I think that when it comes to these sorts of, like the senator said, punitive tariffs, where the president might be thinking that he is putting pressure on a country, but they're also affecting our small businesses as well.
There's nothing that businesses hate more than uncertainty, and so that's really the challenges that we're feeling now. And I get that. I, as a business person, also hate uncertainty, and as somebody who has my 401k, it was tough in March and April to see the big stock market dip. Of course, now we're at record highs. But there's a guy named Milton Friedman who I really like to listen to and read his books. And I also earlier mentioned President Reagan. Both those guys were huge proponents of free trade. But I think we all know that it also needs to be fair trade, right? We can't have people taking advantage of us. We were still under World War II era rebuilding trade negotiations from the 1940s with Germany and many of those Eastern European allies, allowing them to rebuild their nations by us taking on tariffs that would prop up their economies. So we've had some uncertainty over the last 6 months. I think we will continue to have some uncertainty, but that's talking about 1 year in the history of the United States of America. And I'm not in this for 1 year. Brad mentioned at the beginning that I'm getting married in 3 weeks. I'm excited about the next 100 years of my children being alive on this planet. And if going through 1 year of uncertainty was required for us to get trade deals, they're going to allow them to be successful for the next several decades. I personally think that that's worth it. It's not a fun time to go through. I'll certainly concede that. But just yesterday, we had probably the largest trade deal ever announced between us and the European Union, where we have 0%. They have 0% on us. We have 15% on them. That's going to be great for the Illinois and American farmer. So I actually agree more with my colleagues to my left here on this than I'm probably leading on, because I don't like tariffs. I think that free trade is hugely important. I always say there's two things that every economist will agree on, right? Politicians, economists disagree on a lot, but all economists will tell you that rent control is a bad thing and free trade is a good thing. That is like the bread and butter of economics, that when you have open markets that can trade with one another, where people and nations can have specialties and they take advantage of one another's specialties and they share their own specialties on the world stage, that's when economies can really thrive. So I'm not a tariff advocate, but there are some instances where we've not had good deals with other countries. And my hope is that over these next 6 months, like we've seen over the last 6 months, that we'll continue to get some of those things ironed out, and we'll be in a much better position over the next century to compete globally.
Thank you. Something I want to clear up, because there's a couple questions related to, who is here on the panel and who here is not on the panel. This specifically is an event it's called a state legislative breakfast. So the only people that were invited to be on the panel were state legislators. And so just to let you know, that's because they were wondering why we didn't have any federal officials here, and that's just not the focus of this particular event. Another really current issue that I know we're dealing with here at Bradley is artificial intelligence. And so one of the questions is, do any of you use artificial intelligence in your research and in your communications? And before anybody answers, I will say that for the first time, I've been teaching here 18 and a half years. I have now introduced on my syllabus an artificial intelligence policy. In my view, the train has left the station, and the idea that college students aren't going to use it in certain ways is not realistic. I've heard statistics that 95% of college students use artificial intelligence. So what you have to do is put some boundaries and guidelines and try to be thoughtful and reasonable. And that's just my 2 cents on it. But it's the first time that I've had to incorporate that in my classes for the fall. So Representative Weaver, I'll let you start with that.
Yeah, it's a great question. And I'm with you, Brad, with my students. I think that the train has left the station. And I think saying you can't use AI is like in the 90s, if you said you can't use Excel, right? I mean, it's going to be a part of their toolbox that they have to learn how to partner with. Now, they also have to learn the bread and butter and the basics. So I start all my classes with a quiz that's taken with a pen and paper, because I know for a fact that if you have a pen and a paper, the information is coming from your brain onto the paper. So I used to have homework assignments. I've shifted all those homework assignments to now start the class with a quiz, because you can cheat on homework, you can cheat on a paper, you can cheat on anything outside of the classroom. But if you have a pen and a paper, and they complain about this, right? Because they're like, and they've got bad handwriting. they never learn cursive. And so I'm like, your answers must be clear, because if I can't read it, it's wrong. And so we actually do multiple choice. They just have to circle it. But so we've got to teach them the basics of business and economics and science and these things that matter, so that they learn how to be free thinkers and to have information within their brain. but they also have to learn how to partner with AI. So I'll do explicit projects where I'll say, not only can you use AI, but I'm encouraging you to use AI for this presentation, for this project, because you have to learn how to maximize the value of the system. I think that's how they learn to maximize their value of themselves in the workplace. I also use AI. I had a group of interns this last summer, a year ago, and they took giant swaths of Illinois statute and code and just dumped it into AI. And we just did legislative fixes. Maybe it's outdated. It says that this will expire in 2010 and we're still doing it. All sorts of just like cleanup bills, not really philosophical changes, but just bills where the code is dated and needs to be updated, even if it's just a modern language update. So that was massively helpful because they were able to comb through tens of thousands of pages of Illinois law code just as summer interns. So that was great. And also just the ability to turn over new information. So like in my classes, maybe we'll talk about Porter's 5 forces model, right? The 5 forces that act on business. And then we'll also talk about General Electric, and they'll want to learn more about that. So then the next week, I'll be able to assign them a case study about Jack Welch and General Electric and Porter's 5 forces model in the 90s and early 2000s. 5 years ago, that would take me 10 hours of writing this case, right? So they probably would have never had that resource in the classroom, whereas now that resource can be created within seconds. So I think it's massively valuable. We've got to learn how to use it in a smart way, because my concern is that if kids don't learn how to use it in a smart way, that they're just going to learn how to regurgitate what they found on AI and not actually know those things. So I think we're all learning, but there will be a learning curve for how we kind of play offense and defense, right? I think right now kind of AI is on the offense. We've got to learn how to not so much defend against it, but guide it into a way that's going to make us more prosperous. So I'm with you. The train's left the station. It's coming. And the more that we can help ourselves and the next generation use it to our benefit, the more we're going to prosper.
Representative Chung.
Okay. So maybe this gives you a little bit of hope. So I've got 2 kids. They're almost 13 and 10. My 13-year-old has been a little skeptical of AI. So maybe who knows if it's like, nature sort of healing itself, that the younger generation maybe is a little dubious of what AI has to offer. So I don't know. That's my anecdotal thing. But I do have to say that I don't use AI. I might look young, but I'm Gen X. I was born in the 70s. And so, so technology things don't come supernaturally to me, I have to say. I went to high school and did not really have the internet. So I guess that shows you how old I am. But
You're old.
I know, right? But Travis here. So I think that, for me, I have to say I don't use it. And, earlier we talked about data centers. So your data centers, that's basically what they're doing, is churning out AI. So again, if you have concerns about this, I don't know. I don't want to say stop using AI, because again, the train has left the station, as we're saying, but those should be real concerns. Again, when it comes to AI doing and data centers eating up our energy, those are all connected and related right now. So, that has to give me pause. And I guess, me eliminating it is not going to help myself, like personally eliminating it is not going to help the problem. But I guess that, I'll put that out there if anybody sort of wants to think about that some more.
I'm sure I use AI more than I think I do, but I think it's just another boundary you have to manage. It's like saying, well, is the internet good or bad? Well, it's both. So we just have to manage it and make sure that it doesn't control our lives, that we still have control of what we're doing.
So a couple questions from a few of my former students that are in the audience. The other hat I wear at Bradley is I direct the nonprofit leadership graduate programs. And so, Lorraine, wave your hand here. After she retired from the U of I College of Medicine, she joined the nonprofit leadership program, and she has a passion for helping the community, at-risk youth. And I hope I'm not getting this wrong. I think Lorraine graduated at the age of 75 from our program. So was wonderful having Lorraine in our graduate school. Lorraine is worried about PBS and NPR and the lack of funding. That kind of is a little bit related to the news question that we had before. And I know that's at the federal level, not at the state level, but if you guys have any thoughts related to that issue.
Yeah, I think it was pretty punitive in terms of what was done with NPR and PBS. They will survive. I believe that. Probably means that all of us who are donors to public television and public radio are going to have to dig a little deeper, but you know, they will survive, and they're going to be very necessary, because you heard us all unanimously agree that the most trusted news source there is public radio and public television.
Yep, I agree. And, you know, again, it's hard for us to, we can't speak on the federal level as to why that happened, but, you know, it was sort of, you know, shoved into the rescission, right? Am I right? I think so. So it's like one part of a larger package. So, you know, I hope, my hope is that it will survive. I think there are some like more rural stations for NPR, like ones like sort of out of like Charleston, Carbondale, that I know, and maybe even Rock Island, that I might have some concerns about. I've kind of seen some numbers, but you know, my hope is, yeah, that they will survive.
Yeah, I agree. I echo both their points. Well said.
So Lynette Steger, are you still here? Hey, Lynette, good to see you. So Lynette's question is, by 2030, the number of older adults, well, a number of those under 18, making the population. Anyway, the bottom line is, with this question, is there's going to be an increased need for long-term care to meet this aging population. And, you know, what is the state of Illinois, the Illinois General Assembly, what are the discussions related to our aging population and their long-term care needs?
This is a big discussion at the state level, because you know, senior care is a big part of the Medicaid budget. And this is where, when I say that the government lump sums it to the state, and then we have to take what they give us and match it and divide it up. I'm very fearful of what our current situation is going to do to nursing homes and people that depend upon Medicaid to be able to. And you know, it's one of the biggest surprises, and I know you all know this because we've been there either with our parents or ourselves. But people who think that that Medicare is going to take care of you into you know, your nursing home. I hope that people understand that Medicare does not do that. You know, you can maybe get 90 days out of Medicare, but it's Medicaid that is the sole source of a lot of seniors who live living in nursing homes, and that's probably going to suffer. We're going to see that in the next couple of years.
So before I came to the legislature, I was on the McLean County board, and McLean County is one of the few counties sort of in central Illinois, maybe that still has a county nursing home. So we have one. And there was a lot of talk about trying to privatize it, sell it off, whatnot. When I was on the board, I really fought to keep it because I knew that was a very vital service for people who need it. And, you know, and, you know, again, like, it's not going to solve all the problems, but I think that it's one of those things that I was committed to, like, very early on in my career, fought for that. And I, you know the the services that it does provide. So again, as the senator said, it's something that I know that we're going to be having very serious conversations about. And again, with the concerns over Medicaid, I think, I guess we're going to have to look at that some more. I wish I had a better answer for you though, but it's a very good question. Thank you.
The thing that gives me the most optimism in the space is just the improvements that we have in technology. Right here locally, there's a great business called VirtueSense. And if you're familiar with VirtueSense, they specialize in facial recognition technology. Actually, the gentleman who's the founder has a ton of patents associated with the scanning machine where you put your arms up at the airport and it turns around. So brilliant guy. And this technology is great for somebody like my grandfather who wants to stay in their home, is still physically strong and capable, has trouble seeing, is maybe an issue of tripping. He's got the button on his neck, right? That kind of person that isn't quite ready to have somebody in the home, but if he had an accident, then he maybe could progress there. So what VirtueSense technology can do, and this type of technology can do, that I think is coming in the very near future, is put a camera in your house. And it's not a camera like, the one that has this projector in the back of the room here. It's more of a camera like at the airport, right? When you put your hands up, they don't see the person. They're just scanning to see the things that are on your person. And so if you have an issue at home, or like if it can tell if you're getting up slower than you used to, so it can track progression of deterioration. So all sorts of things that it can do to alleviate somebody who maybe used to need somebody in the home, but now it can prolong that and be home on their own volition for a little bit longer. So I think there are some technology advantages that are coming, and my hope is that those advancements will help alleviate the pressures on the system. But I'm hopeful about things like VirtueSense.
So here's a new topic. Illinois state employee pensions are excessive, and they've created a mammoth budget deficit. What can be done to amend these pensions to a more reasonable level and help make the state of Illinois more financially solvent?
Well, we already have a two-tier pension system that we put in place in 2011. And there's a lot of pushback from current employees who now make up a majority of the employees at the state level and within the ranks of teachers. And there's a lot of push to amend the two-tier system so that it becomes, in their opinion, more equitable for what retirement benefit ought to be. There's also the safe harbor issue with the IRS, which says that if you're going to opt out of the Social Security system, that you then need to have your benefits at a comparable level. And if you dip below that, the federal government could come in and actually take over your plan. So since 2011, there's been a big shift in terms of what the state has to pay for pension benefits. It's not well received with the current employees. So we're not going to see any further reductions in terms of those benefits. We have projected right now that by 2045, I think it is, that there should be more stability and more fully funded pension systems. I came into the legislature, the history of this goes way back when, and a lot of the problems that came into our pension system were because of the compounded COLA. And that was something that under Governor Thompson was put into law at that point as part of a negotiation with the unions. The compounded COLA really just started eating us alive. And that has been put aside. There is no more compounded COLA. In the 90s, Governor Edgar and the legislature did a pension revamp, and they said, we're going to create a 15-year level payment for the pension system. And then at the end of that 15 years, if the pension system hasn't caught up because of the market doing very well, then we'll have a ramp and the ramp will be very steep, and it'll require more payments by the state each year. So I came into the legislature right when the ramp hit, and it was all of a sudden, we started looking at increases of billions of dollars each year. I think we're now probably close to 15 billion a year for our pension system. That's going to level off in a few years, and it's going to start to help the whole pension system. No one in the state is going to lose their pension. I mean, the pensions are safe. And when they talk about it being a percentage of unfunded pension liability, if everybody retired on the same day, all at once, yes, there would be that liability, but it's not. It's an ongoing system. A defined benefit system, which is kind of a dying breed in and of itself. Most companies have gotten rid of their defined benefits. It's not a bad system. It's like a big insurance pool. You all pay into it, and you'll get your pension if you live that long, and if your spouse lives that long. But once you die, then the other folks that are in that system are the beneficiaries, and so it's not a bad system. With a 401k system, you pay that, it's out the door. It does not come back. But the defined benefit, at least it remains as more or less an insurance pool. So there's not going to be any further reductions of pension benefits. I can pretty much guarantee that. There may be some enhancements depending on the political will of the legislature and the governor. This is probably not the year to be talking about it with having such constraints on the budget. But that's kind of where the pension system is right now.
And yeah, I mean, both Travis and I came, we were both came in 2023. So we were not part of any of those sort of decisions when it came to, any sort of tier 2 or any sort of decisions that led to those decisions being made. I think that in Illinois, they, for a long time had, and this is even before Senator came in, but, for a long time had underfunded pensions. So at least from the way that the question was worded, it makes it sound like that. I'm not sure if the asker is thinking that the people that this is with the word excessive, it makes me think that they don't think that the pension should be funded. But I do believe, again, when it comes to people who have worked for the state, those workers, the pension is a promise, and that's something that I still really do believe in.
Yeah, so just to start off with table sake, something that all of us agree on that's been ratified, confirmed by the Illinois Supreme Court is that a pension is a promise, it's a contract. When you sign up for a contract, it doesn't get renegotiated later when one party wishes that they would have done things differently. So anybody who's receiving a pension will continue to do so. That's just, I think, being morally sound as a legislator. I'm really glad the Supreme Court did that. But our pension is a giant challenge, right? It's the nation's largest unfunded pension liability at $180 billion. We've got to figure out how we're going to get our arms around. I think there's a couple of things that we can do. Number one, we've got to be really thoughtful about anything that we do that's a pension increase. Now, there are certain things where it may make sense, like, if somebody is a fireman or policeman and they die on service, how does that benefit transfer to their wife and children to make sure that that's being preserved? Some could call that an enhancement, but I think also similarly, it's just kind of the right thing to do. But these wholesale big enhancements, like one initiative that we saw earlier this spring, was to take all of tier 2 and put it effectively back on tier 1, which would be an $84 billion price tag to our unfunded liability. So right now we're at $180 billion. It's the largest. That would tack another 80 on top of it. To me, that number is really just a non-starter. We can't afford it. Our pension costs are 20% of our annual budget, which is really challenging because it's debt, and there's good debt and there's bad debt, right? Good debt is you buy a house, you take out a mortgage out on it. You're using that asset while you're paying down the debt. So you're continuing to get the benefit. Putting a trip to Cabo on your credit card, that's horrible debt, right? Because now 10 years later down the road, you're still paying for this service that's already been rendered that you're not getting any value out of it anymore. Maybe you've got pictures and memories, but the asset no longer exists. So when we have an unfunded liability, what effectively is happening is somebody is serving the people as a teacher, a cop, or a fireman, and you're not funding their retirement while they're working. So now that person's retired, and so we're paying for services already rendered while we're no longer getting them. So it's not like an asset like a house that you're paying for while you're using. It's something that we didn't pay for while we were using it. So now we're left paying for old government. And it's 20% of our annual budget. So that's a pretty big chunk. Now, I do think there are some challenges that we have with the tier 2 pension system, primarily that folks have to work until they're age 67. And I don't know about you, but if I was chasing around 6-year-olds all day, I'd be pretty ready to be done with that well before I get to age 67. The bill that I have filed that helps address this is a 1-1-1 match amongst the employee, the employer, and the state. Pick a number, maybe $2,000 a year that I, as the employee, put into this 401k type system. My employer, say that's the school district, puts into the system, and the state puts into the system. So that's $6,000 a year. You fund that over your career. And then now you put retirement in the person's own hands, because even though they can't collect until they're 67 on their pension, that doesn't mean that they have to work until they're 67. It just means that they can't collect on it until that age. So if you have a pool of money, say it's $120,000 and you're 60, the math is up to you. If you say, you know what, I got 7 years left, but maybe my spouse is still working, or I can pick up a side job, and I know I've got $120,000 in this fund, that can help me bridge the gap until I get to 67, because I'm done chasing around 6-year-olds. Or maybe you say, you know what, I'm at 60, but if I can work until I'm 63, now that pool of money is up to $140,000. And so that helps me bridge the gap a little bit easier. So my solution isn't necessarily to revamp tier 2. It's to just help people put retirement in their own hands a little bit better, so that as you approach that age of 67, if you're not in a position where you're wanting to work that much longer, you could retire it at 57. You're going to have not a lot of money in the pool, but maybe you don't necessarily need to. Like I said, maybe your spouse is working, maybe you want to do tutoring on the side that's going to help you bridge that gap. The primary point is that the choice is yours to make, and the state and your employer and you yourself as the employee are working to fund that pool to make sure that you have that option as being available.
Interesting.
Okay, we're getting close to the end here. I'm going to do 2 more questions. And there are several questions that are related to the immigration issue and deportations in Illinois. And, you know, your thoughts, and, you know, are there any efforts in Illinois with regard to that issue? So anyway, I'll just throw that.
Well, obviously, Illinois is a sanctuary state, and that was put in place by a Republican governor. I personally wish that Illinois wasn't a sanctuary state. I think that there's a lot of people that work really hard. My chief of staff, as a matter of fact, his wife is from Ecuador, and they're still going through this challenge of getting her to be a legal citizen, even though they've been married for coming up on 2 years at this point. And he's in the Illinois National Guard. I mean, this is a person that you would expect the government would want to embrace and want to take care of. So I fully support total immigration overhaul reform. I think it's needed. We're obviously a nation of immigrants. You know, obviously the promise from the White House is that we're going to go after dangerous criminals first, and people that are here law-abiding citizens don't need to worry. The reality is that they're going to continue to worry. I think that we do need to get rid of some people that came into our country illegally. There is a process to come here legally, and that clearly wasn't followed. Now, it's a little hard to put that responsibility on the person when the previous administration said, hey, don't come to America, and then winked at the camera because the border was wide open and millions of people are coming in every single month. So it's a little hard to say that it's their fault when they came under the pretense of thinking that they were welcome. The reality is we need immigration overhaul. I'm not a federal congressperson, so I don't have a lot of talking points on that. But I think it's just common sense. And I also think it's common sense to say that if somebody here is a criminal that is causing problems, that it's pretty reasonable to ask them to leave. I also think it's fair to say that if somebody here is a law-abiding citizen just trying to provide for their family, that probably should not be a priority of the government to get them out.
I think what's clear, though, I have to say, is that, where they're saying that they want criminals to be deported, that's also not happening. I mean, we've got regular people who are being deported right now, people who've lived there their entire lives. So my parents are immigrants from South Korea. My mother was able to come here in 1970 because she was a nurse and she didn't want to live in Korea anymore. And so she was able to come here on a program, a visa, to be able to work as a nurse here in the United States. My father came a number of years later. I do know he is actually still a Korean citizen. He didn't want to actually become an American citizen. He wanted to keep his Korean citizenship. My mom is a U.S. citizen, and I do have to say, every day their little thought kind of goes in my head that, like, what's going to happen to my dad? Because again, he might have had a couple of things like his record probably when he was younger, when he came over here, some unpaid things, who knows? I'm not going to sell out my dad right now, but I do have to say that, that fear does go through my head, because what if, who knows? My father, who has lived in this country for 50 years now, who knows what will happen. I don't mean to be like fear mongering, but we've seen stories of things like this that are happening all around the country. So, it gives a lot of fear to me. I've spoken with a lot of people in my community who are also scared, and we have, trying to figure out how to best provide legal resources to people. Because again, like Travis just said, he has somebody who's trying to get somebody become a citizen, and it's taking a really long time. That's what's just happening, and that's the truth of it. I mean, people are being afraid to go to work. People are afraid to send their kids to school. My younger kid goes to a school in Bloomington that houses the English learners, sort of. So there's native Spanish speakers, and they get bused to the school, and they have a class where there's at least one teacher in every grade that is a Spanish speaker. So, I do know that attendance did drop for a little while there. I think that I hope that the students did end up going back to school. But again, those fears are very real. And just because, the president or our congressman is saying that they're doing something a certain way, but we're not seeing it being done a certain way, I think that those are real fears, and I don't want to discount them from people in my community.
I think it's shameful that we do not have a immigration system in this country. And I think one of the biggest unfortunate occurrences of the last election was that I think that there was a possibility of the Senate coming together and having a bipartisan immigration bill. And because of politics, that got blown out of the water. Immigration is a very emotional issue. And so you have politicians that take advantage of that. And we create fear, and we create hostilities against one another. There's a family here in town that my wife and I have gotten to know. This couple's parents are citizens. Their children are citizens. They are not. They have been on the list since the early 90s to try to get their citizenship. That is not a system. That's disgraceful. We can do better than that. And we just have to have the political will to do better than that. Unless you're an indigenous person of the United States, we're all immigrants. I'm second generation, you're first generation. My grandparents came from Russia. We all have stories. This is a nation of immigrants. We need to be respectful of one another, and we need to do this right. This is shameful.
Okay, we're going to wrap it up, but before we give a rousing applause to our three wonderful state legislators, well, you go ahead. I've got the prize winners.
All right.
Oh,
So if you have tickets, the first one is 1087730.
You had a ticket? Oh, that's funny.
See, I thought everybody stayed because it was so interesting.
Exactly. Then 1087721. Okay. So again, let's thank our legislators. Thank AARP. Thank OLLI. Thanks for coming.
Thank you all.
Have a good morning, everybody. See you.